Costa Rica is located between Nicaragua and Panama. The climate of Costa Rica is tropical and subtropical. The terrain in Costa Rica contains many volcanoes and mountains. The dominant language in Costa Rica is Spanish, but English is also spoken there. Costa Rica's top three major burdens of diseases are ischemic heart disease, diabetes, and road injuries. These burdens of diseases are associated with risk factors such as high blood pressure, high body mass index, and high fasting plasma glucose. When it comes to Costa Rica's quality of health care, high income and upper middle income families receive better health care. The problem is that Costa Rica is mainly middle-income citizens, meaning that these middle-class citizens do not receive the same quality of care that the upper middle and high-income citizens receive. Another contributing factor to health problems in Costa Rica is their diet. Costa Ricans typically eat rice and beans every meal. When you eat large portions of this food, it leads to risk factors such as high blood pressure, high body mass index, and high fasting plasma glucose. Costa Rica is also lacking funding for research for improvement in medicines and treatments regarding healthcare. Research on issues like cardiac issues, diabetes, and cancer would further improve the health of many lives, leading to new treatment options. Culture, religion, economics, and government impact the health status in Costa Rica. When it comes to culture, the tourist industry plays a big role in how citizens in Costa Rica make money and live. Costa Rica gets about 1.7 million tourists a year from people coming mostly from the United States and Canada. The citizens of Costa Rica make their money from these tourists. This income helps the citizens of Costa Rica be able to afford health care. The majority of Costa Ricans are Roman Catholic. Some indigenous populations do not believe in surgeries. This is where economics and government come into play. More money needs to be spent on research on health care in Costa Rica. Only 8% of the GDP is spent on health care in Costa Rica. The middle-class citizens are lacking the high-quality health care that upper class is receiving. Research on issues like cardiac issues, diabetes, and cancer would better improve health care in Costa Rica. Since Costa Rica is already spending less money than other countries are, they can delegate tax money and much more to spend some more on health care. Costa Rica isn't spending as much money on health care as other countries. They are spending about 2 times less than other countries. Creating funding for research would allow for many advancements in healthcare in Costa Rica. Since Costa Rica's major non-communicable diseases are ischemic heart disease and diabetes, they could do more research into medications and treatments for these diseases. To generate money to be able to conduct research, an increase in taxes would have to take place. When it comes to the Costa Rican diet, it mainly consists of rice and beans for every meal. These foods are not bad for you if you eat them in moderation, but for many citizens in Costa Rica, they are intaking large amounts of these foods. So, a recommendation to improve the diet and health status in Costa Rica would be to educate the residents on healthy food alternatives. This will help cut out the high sodium intake that citizens are struggling with, leading to further health complications. Public health care in Costa Rica is almost completely covered by CCSS. This leads to there being long wait times in hospitals and clinics due to citizens' health bills being almost completely covered. The public healthcare system in Costa Rica contains a network of 30 hospitals and 250 clinics. When it comes to decision-making regarding planning, sanitary regulations, research, and technology development, the Ministry of Health is in charge. When it comes to private insurance in Costa Rica, 30% of people have it. Private healthcare is more expensive and mainly the upper class has private insurance. Private health services come with some advantages, such as private hospitals and ambulatory settings. Because of the prices of healthcare in Costa Rica, it has become a place for medical tourism. Overall, the United States spends more money on healthcare than Costa Rica does. The United States has mainly a privatized healthcare system, while Costa Rica has a universal healthcare system. The fertility rate is quite similar in these two countries. The number of physicians per 1,000 people are also quite similar, with Costa Rica having a slight increase than the United States. Healthcare in Costa Rica is cheaper than healthcare in the United States, making it a hub for medical tourism. Costa Rica receives $300 million in funding in 2021 for healthcare. In Costa Rica, there is a higher education program that helps improve the quality and access to healthcare. This program benefited the indigenous students in Costa Rica. This program has helped enrollment programs for undergraduate students go up to 102,000 students. And for graduate school, it went up to 7,000 students. A project in Costa Rica called Strengthen of the Universal Health Insurance helped reduce wait lists for chronic diseases. It has helped 41% of patients with type 2 diabetes to get clinical control and helped improve colon cancer screenings by 15%. Another program called Disaster Risk Management has helped Costa Rica prepare for disaster and create reduction and prevention programs. Lindsay Melzer is a close friend of mine that went to Costa Rica through a third-party program to study abroad. She lived with a host family and mainly ate rice, beans, fruit, and drank lots of coffee. Lindsay mentioned that the majority of Costa Ricans are Catholic and that her host mom had a Mother Mary figure in her living room. Lindsay mentioned how the majority of Costa Ricans can't afford health care and that private practices are very rare. She said that her favorite thing she did was visiting the beaches and going surfing. Costa Rica contains mainly middle-class citizens. Costa Rica's healthcare is universal. Costa Rica still has some issues to resolve when it comes to healthcare. More programs and research need to come into play to help improve the healthcare in this country. Costa Rica spends less money on their healthcare than other countries, and this needs to be changed. Unfortunately, this means they will need some funds coming from somewhere. One way they could do this is by increasing taxes. Overall, Costa Rica's culture, religion, government, and economics all play a role in the health status of this country. And this is the reference page for my PowerPoint.